So what I'll go through is just a few slides to discuss our fund as a case study of an example of the types of fund the facility could be supporting. Move to the next slide, please. And this is really positioning us in the ecosystem. So our fund, we're currently targeting 100 million. We started out, hoping to have a larger fund, but I think that's probably where we'll end up. Our final close is in in September. We've just pushed it back. And what we were able to do for our fund is to structure it so that we're able to offer investors enhanced upside and 30% downside guarantee. As we talk through the examples of investments we've made, you'll see that they are, at the highest return expectation of the spectrum relative to other investment opportunities. But nonetheless, women and children's health is an area where investors are less familiar, and so the enhancements that we're able to offer were helpful in attracting groups that are just moving into impact investing for the first time, and the majority of which have never done anything in the global south. So we're sort of a teaser for those groups. And we also have some groups like KFW that have deep expertise and a long track record in this sector. A little bit more about our strategy. We focus on sexual and reproductive health, maternal, newborn, and child health. We also invest in opportunities that address non-communicable and chronic diseases like cancer, cardiovascular health, and also health infrastructure software, everything done with a gender lens. And so that brings us in areas like digital tools, diagnostics, medical devices, and therapeutics. And for our fund, we're an impact fund, so we have specific impact targets for each investee, and at the fund level, we'll be targeting 400,000 lives saved and 8 million lives improved. A little bit more about our ecosystem positioning, moving kind of on the right side of the slide. If you think about what it takes to deliver healthcare, you need a physical health delivery system, and I think we saw a great example in the ambulance case study earlier for the Zambian market. You also need tech-enabled healthcare delivery. Think about that as a telemedicine type of applications. And in both those cases, then these tend to be a little more localized, I would say, or certainly the better solutions that I see. They're not areas that we will invest in directly, but we will partner with those groups. They tend to be very locally driven types of plays because each market is so different that you need a ton of localization and specific approaches. The other piece that we see is financial access. So if you think of that as everything else that it takes, so insurance, tax, small business financing, education, et cetera, again, very localized priorities. And where we fit in is more on that global health technology side. So when you think about new medicines, new medical devices, new diagnostics, we'll see a couple examples later on. But that's where we fit, where these technologies, they always require, in my view, to scale optimally in local markets, a local entrepreneur that is helping with the scaling up, whether they're ultimately an employee of the company or a partner, if you think about a distribution partner. But these are technologies that tend to be relevant across market types. So we'll see an example with a fetal medicine ultrasound software system where scanning a baby using ultrasound is actually pretty similar from a software point of view, whether you're in northern Canada, New York, or Zambia. The piece that I wanted to highlight here is what our biggest challenge. We really have two, I think, that the facility can help solve for. One is fundraising, to give you a sense of what it takes to raise a women's and children's health technology fund with an African impact thesis. We've talked to well over 1,500 different investors and connectors over the last 3 years. And we're at about 70, 80 million raised. So it's taken a lot of time. And what I was telling Joanne is, we're accepting very small investment sizes in some cases, $250,000 to $500,000. And it's really hard to get to a vehicle of significance. And this is where we have a guarantee that brings us up to 200 million if we had the capital to raise, and a huge pipeline of opportunities. The other challenge that we have is access to technical assistance and growth partners, entrepreneurs on the ground that can be leading the local strategies in partnership with the investee companies that we finance. Moving to the next slide. A bit more here on fund of funds. It's a bit of an eye chart, but for those who are interested, I'm very happy to circulate the deck afterward. The opportunity here to invest through funds or funds of funds is really quite significant. And again, we're one kind of fund, but there's lots of others that are deeply relevant, focusing on the other aspects of delivering healthcare and financial empowerment. But the sector is in its infancy, and what we see in the next 10 years is $2.1 trillion changing hands, and yet there's not any kind of movement of money. In fact, what I've seen in the last 3 years are players moving out of healthcare, out of gender issues, into climate and other priority areas. And yet, if we had the opportunity to build a track record of success in this sector, we know that there's lots of money that could join all of us who are the early players. We can also, if you invest through a fund or a fund of funds, that allows you to not have to pick which social priorities you want to go into, because this portfolio of funds and funds of funds will pick and invest at different aspects of the issue. For example, I have very good friends that run funds that are focused on local entrepreneurs. I have some friends who are focused more on healthcare delivery, infrastructure, energy, and a fund of fund structure has the ability to target multiple priorities. You also get the multiplier effect, whereas each investor, if you invest in one investment, a fund can do 10 to 15, and a fund of fund can do 10 to 15 funds. So you see that you have the ability to achieve a lot more through pooled vehicles. The other aspect of it is, it's been done before. So an example I often give is the fact that in the early 2000s, when I started in the investment sector, clean tech was kind of small. It looked sexy. It had died and been reborn multiple times since. But along the way, the strategic players got involved, and today what we see, in the energy sector, of course, the strategic players are the big oil companies. They now invest over $7 billion per year in lower carbon solutions, and VCs will invest up to $17 billion. So success is possible if we can create the momentum. And finally, I'll just speak a bit to the ecosystem building. By having a larger fund of fund, you create these opportunities like what we were talking about earlier today, where you have kids OR that are, an implementation partner, probably more financed by the technical assistance facility, where we invest in technologies that could be useful to those groups, or to a group like Nest 360 that does the distribution. And so it's really, having these larger pooled vehicles offers that opportunity for those natural connections that lead to greater impact. Next slide. So I'll just end with two examples. So this examples from our portfolio is a virtual tumor board and cancer care clinical decision support tool. What it offers is the opportunity to bring multidisciplinary cancer practitioners onto a software platform that allows them to do these consultations that allow for a determination of a more optimal treatment than just one doctor in one hospital could come up with. These can be run within a health system, so a network of hospitals, let's say in the US or in Turkey or in Afghanistan, where the company already operates, but it can also be across countries. It can also link, a central university hospital with community hospitals. So there's a lot of different ways that this works, and it reads the information from whatever the electronic health record system is in that country region. You need a bit of integration in some cases, and it facilitates a virtual call and takes notes and records the treatment for future learnings. It also brings up medical information on new clinical trials, which can be helpful for more challenging cancers and help link doctors to researchers and different hospital networks. The company, our investment is going to scale up the company, and we're helping them enter the Canadian market, at least 2 African countries, and probably expand as well to India and other countries in Southeast Asia. The technical assistance dollars that are needed to really enable this are long-term financing for some of these applications where governments are perhaps not yet ready to finance them. So if a technical assistance facility was available, you could easily set this up for a reasonable amount of time to really prove out the usefulness of the approach. We also need links to international hospitals that want to be supporting local health centers. And so it's really linking, let's say, a cancer center in Boston with a cancer center in Zambia, and creating that approach in the cloud where collaboration can occur for broader training. And that's also inclusive of the more localized health centers. And the other opportunity, the final one I'll list, is to create programs that are cancer specific. So this could be around breast cancer across multiple different countries within Africa, or multiple different regions within one country, or it could be around childhood cancers. The company is set up to support all of these types of effort, but financing, expertise, and connections are required. Moving on to the second case, and I'll just end there. This is more in the newborn child health space and maternal health as well. This is a piece of software that was created to optimize the reporting approach for ultrasound care. So in the US, the way this is done is often an exercise when an anomaly is detected. The practitioner has to by hand write the findings. And so this allows to pre-populate the findings of an ultrasound through AI and intelligence. And at the same time as doing the quality control on each image that is being taken. In the African context, of course, the huge benefit is, from what we understand, reporting is not even done and not often shareable. And so if a patient, particularly in places where you're paying out of pocket for ultrasound care, it's really disappointing that you don't have access to your data to see your specialist next, and you have to repeat this exam. And the other aspects of the software is it's highly tailorable to a health system. And so, for example, in India, we block out the gender. For example, in certain regions of Africa, you could tailor the diagnosis that you give to the things that are actually treatable. And you could start with simple conditions like placenta previa that can lead to postpartum hemorrhage. And then as the country grows and the health system gets more sophisticated, you can add more and more as you're able to actually treat those conditions. And this is a tool that can be used. It has 2 benefits. It was proven with a similar software that using ultrasound care during the treatment of the mother helps create a bond and care-seeking behavior, in addition to streamlining women that have higher risk to higher risk centers so that they can deliver safely at the time of labor. The technical assistance opportunities here are really investments in local software distributors and ideally connections to local entrepreneurs that want to be the distributor of those software. So I'm quite excited to speak again with Dr. Roma to connect with the nurse labor force locally, because they would be ideal business owners to launch this type of approach. We also need capital for research studies, and we also are looking for connections to chains of ultrasound clinics in local markets to distribute the software and use it. And so I'll just pause there and can pick off the slides. But these are just a couple of examples of those kinds of technologies that are globally relevant, but would benefit from localization and partnerships, as well as financing for research and those kinds of activities.